Okay, so I'm looking at my dad's face for symmetry and his neck for symmetry, and he's both symmetrical. I'm looking at the temporomandibular joint. Can you just open and close your mouth for me? Bring your chin from side to side, like there you go. And retract your jaw. Good. And protract it. Stick it out. Good. And I didn't hear any clicking or feel anything crazy in there. I test his neck, palpate his neck for tenderness. Did you have any tenderness there?
No.
Good. I'm going to test the neck muscles for range of motion. So can you put your head down, your ear to one side, the other side? Can you look all the way up? Bring your head to your back, and then look all the way down. Good. So then I'm going to have him stand up. And can you touch your toes for me, or try to? Okay, and I'm inspecting his spine and palpating it for anything abnormal. I don't feel anything. And he's got an aligned spine, and he has pretty good range of motion. Can you stand back up? And can you bend to the side for me? To the other side. And I'm going to have you, there you go. Okay, good. And you touched his toes, so I know he's good there. I'm going to check his shoulders, and he's got good height, and they're both symmetrical. I'm going to check, can you put your hands and wrists out for me? And he's got good position. I'm going to test his strength. Can you push up against my hand? Can you push down against my hand? Good. And I would test the other side. I'm also going to test his shoulder. Can you not let me can you put your hand down towards gravity? Or just push down.
Oh.
Okay. All right. And then push up. Good. That's good. And can you do the same thing with your arm flexed? You're just going to pull up against my hand. Good. And then and then push down. Good. Okay. And you can have a seat again. I'm going to look at his hands for how many digits he has. He's got 10, which is good. And he doesn't have any tenderness, edema, or anything crazy going on with his arms or his shoulders. So then I'm going to test his Phelan sign. Do you have any tenderness there?
No.
Okay, and can you put both your hands together like this? Do you have any tenderness in that joint?
No.
Okay, good. So now I'm going to check his hips, knees, and feet for symmetry, which they all are. I know you can't see it, but they are. I'm going to test for stability, any pain, tenderness, or edema, which he doesn't have any. I'm going to, why don't you lay down on the bed, Dad? And can you just, can you lift your your left leg off? Okay, good. Can you bring your left leg across your body? That's abduction. Can you bring it away from your body? Abduction, good. Can you bend your knee? Good, and extend it. And can you bend your ankle? And you can roll it around, good. And wiggle your toes. Good. You can sit back up. Okay, so I evaluated my dad for his level of consciousness. He's alert and oriented ×3. I'm going to test his olfactory nerve. Can you just close your eyes for me and cover one nostril and tell me what you smell? Your favorite?
Coffee.
Yeah, good. So you can let go. You can open your eyes now. We've done the visual acuity and the peripheral vision in a prior exam. So I'm just going to check his pupils for symmetry and light. Or reaction to light, I should say. And so I'm just going to do this again. Good. We've done the accommodation and the visual movement, ocular movement before. Can you just tell me if you can feel this on your face?
Yes.
Here.
Yep.
Here.
Yep. Yep.
Okay. I'm going to have him raise your eyebrows for me. Good. Puff your cheeks out. Good. Smile. Show your teeth. Can you purse your lips and blow? Good. We've already done the whisper test, the Rin test, and Weber test. So we've done that. And I'm going to look at your mouth, and I'm going to ask you to say ah. And yawn for me.
That's tough to do.
I know.
shut off over here.
That's all right. It'll still go. Can you shrug your shoulders for me and round them out? And those are symmetrical. I'm going to test the tongue for movement, symmetry, strength. So I'm going to look at his tongue again. And he doesn't have any tumors or any kind of fasciculations. So that's good. Okay, so now I'm going to have you stand up and we're going to do some tests for your positional. So what we're going to do is I want you to just close your eyes and stand there. And he's swaying a little bit, which is normal. You can open your eyes now. I'm going to have you put your arms up, palms facing up, and then I'm going to have you close your eyes again. And his arms are staying in the same spot, which is also normal. Go ahead and put those down. And can you hop on one foot for me? Good, you can stop. And I want you to walk heel to toe. So one foot in front of the other, like you're walking a tightrope. Good, that's normal. Then you can sit down. And what you're going to do is put your palm and then the back of your hand as quickly as possible. Just one. Good. That's normal. I want you to take your arm and touch your toe. Touch your nose, and then touch my finger, and then touch your nose, quick as possible. Okay. And then you can lay down, and you're going to slide 1 foot. Take 1 foot from your knee to your big toe. So take 1 foot, put it on your knee, and then slide it down to your big toe. Good. Perfect. Okay, so what I'm going to do while you're laying down is I'm just going to ask you if you can feel this.
Yep.
Okay. And that?
Yep.
And that?
Yep.
That?
Yep.
Good. Okay, you can stand up. Or you can sit up, sorry. I'm going to test your vibratory sense. So I'm going to hit this and put it on your big toe, and then just tell me if you can feel it. Feel the vibration?
No.
You don't?
Do it again. Oh yeah, right there.
Okay. I'm going to take your big toe, and I'm going to put it up and down. And that was his position sense. And I'm going to put an object in your hand, and I want you to tell me what it is. So close your eyes. What is that?
Piece of cotton.
Thank you. Okay. And then the next thing I'm going to test is your 2-point discrimination, which if I can find that paperclip I had would be good. Oh, here it is. Okay. So I'm going to put this on your hand. And you just tell me when you can't feel it, you feel it as two separate things, okay? Feel it as two separate points?
Yeah.
Let me do it again. You tell me when you feel it as two separate points.
There.
Okay. So that was about 3 millimeters, so that's normal. Okay, and then I'm going to draw something in your palm, and you need to tell me what it is, okay?
Do it again. Like a 3.
Right. Okay, and so now I'm just going to check your deep tendon reflexes. So just go ahead and relax. I'm going to do your biceps tendon one first. So just relax your arm and then hit the tendon. I'm pretty sure this is my technique, so I'm going to say that he's probably got this deep tendon reflex.
I got 3 things of clothing on too.
Yeah, it's probably. So we're going to test your triceps. Let me do this one. Okay, so I got a little movement there. That was good. So now we're going to do one right here. Do this like that. Relax it. Sorry. I've got some movement there. I'm going to test his knee. That one was good. And I'm going to test his Achilles, which you're not going to be able to see too well, but did that hurt? Oh, you're going to feel tendonitis.
Yeah.
Sorry. And I'm going to test his ankle clonus, which he probably doesn't have any, but, and no, that's normal. And I'm going to test his Babinski test. I'm just going to run this down your foot. Sorry, he's ticklish. And you had a normal reflex. So that's the end of the assessment.